Welcome to Launch Vanity. We're going to have an interesting episode today on a hot topic, and this topic is all about GLP-1 inhibitors. So this is a controversial kind of topic depending on who you talk to. People have very strong views about it. Some people are very in favor, others are, concerned or fearful. So again, this is one of those kind of things where there's just a ton of talk. So today we want to spend a little bit of time really looking at that and doing our best to give it some good balanced discussion. So I'm just trying to get our streaming software up and going here, and then we'll get going. So bear with me while we get started. Let me just add this little stream key. It doesn't seem to want to pick up right away. So I'll just go here, and we're going to just clear out the old one. Ooh, it's a long one. Here we go. Let's see if I can get that out. And then we'll put the new one in, save, and with the magic, we speak nicely to it. And I'll just close those windows. Okay, let's see if we can get this to work. Technology is always the most challenging part of all of this. So here we are, and let me just make sure we're going live over here. It looks like now we can. All right, there we go. So we are active and fully up and operational. Okay, so let's get started. A few important notes as we launch any given episode. We just have to talk a little bit about what this whole podcast is about and what, of course, it's not. So the topics we cover here really are intended as educational advice. They are meant to bring up important points for you to consider, and they're important points for you to go back to your own care provider and have these meaningful conversations. So this is meant as pure educational content. What it's not meant to be, it's not meant for diagnosis or treatment or to prevent or cure any disease. So please view this in the way it was intended, as just good, open, educational dialogue. And with that said, let's dive in. So these last several years, you've been seeing probably everywhere you look, whether it's on your social media, whether it's the news, TV commercials, and the like, that GLP-1s are here and they're here to stay. So historically, these medications were first produced to try to work with diabetic individuals, particularly type 2 diabetes. Those individuals have a lot of metabolic malfunctioning things going on that ultimately results in sugars that are too high and all the downstream difficulties that go along with that, like cardiovascular disease, for example, or small vessel disease, where we start to have issues with the vasculature of the eye, and you can have vision loss, or the kidneys, and you can have kidney failure. There's all sorts of different reasons why people can have those problems. But again, at the heart of it all, again, we have diabetes driving a lot of this. The high blood sugars create a lot of inflammation and damage throughout. Even the delicate vasculature of the brain is vulnerable, and we see higher instances of dementia and other brain-related issues when we have high blood sugar. So these were revolutionary medications that came to the market that were able to help these individuals metabolize sugar more efficiently, along with, again, overall metabolic health. And so that's where they were first positioned. That's what they were first approved for. But what was noted very quickly was that these individuals were able to obtain weight loss. And it was pretty obvious, pretty fast, that the individuals initially being treated for diabetes were successfully losing weight. And again, we're seeing the benefits of that as well. So that was sort of the beginning of the revolution around weight loss. So now today, the medications are actually individually approved for very specific reasons. Some of them do not yet have indications specifically for weight loss, but it's not that prescribers don't use them that way. This is called off-label use. So, and this isn't a new or a strange practice. Physicians have been doing this for a very long time. And so what off-label means is that you're using an approved medication, but the reason why you're using it is not how the governing body originally approved it. So if you're in the US, that means the FDA did not approve it for a specific indication, which you can still use it for, but it would be off-label, not the approved use. As well as in Health Canada, we do this as well too with our medications here. And this is very common, very normal practice. It happens all the time. I'll give you probably a super common example, which again, nobody would even think twice about, birth control usage. So again, there's controversy around that too, but let's just use it as an example of off-label. So for many, 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 many years, there were quite a number of birth control pills that were approved for birth control, hence the name, and that was their indication. But a lot of doctors noted that there was better acne control with the use of birth control pills. And so sometimes it would be offered as one of the tools in the toolbox to help control acne. Or, for example, they may find that period cramps were remarkably improved. So again, it could have been given to try to help with that problem. Again, not necessarily approved for that whatsoever. Or period regularities. Again, these all are different reasons why people might take it, but unless the pharmaceutical company went specifically to get an approval for that, technically that is what is off-label. So fast forward to now and the GLP-1s. So GLP-1 has, again, across most brands are approved for diabetes. There is a movement now to use them for medical obesity. Not all of them have that yet, but I think there will definitely be a place and a space for that as we move along. So then the controversy started because obesity really is a medical problem. It is not just a cosmetic problem. And if somebody actually has medical obesity, they are not being vain by wanting to treat that. So please hear me. If you really struggle with weight and you're overweight, you are not being vain by looking to try to assist yourself with that process. This is a very difficult problem. Our food, our lifestyle really sort of sets the stage against us before we layer in all the other variables of life that conspire against us. And we can talk about some of those different specific things. But let's just talk about what that extra weight actually does outside of just, again, appearance. It is a health issue. Visceral fat, for example, the fat that you carry on your belly underneath the muscle, that surrounds the internal organs and is a very inflammatory form of fat. At its simplest, sometimes instead of doing BMIs, we do hip to waist ratio, trying to measure how much visceral fat there is. It's a way to quantify, a simple, basic way to quantify how much fat is there. Because we know individuals who carry a lot of weight on their trunk, visceral fat, have a lot of internal inflammation, which is very, very strongly associated with cardiovascular disease and again, risk that way for cardiovascular disease, for diabetes. We're really thinking that a lot of the slow decline dementias, there are many reasons for dementia, many different pathways to develop dementia, but one of the pathways to dementia may be through sort of these diabetic-like, metabolic-like processes. In some circles, for example, some of these longevity meetings I'm going to, they actually refer to these types of cognitive decline as type 3 diabetes, or basically, again, metabolically induced inflammation and changes associated with that, that again cause cognitive decline. So these are things people don't want. The number one killer out there is still cardiovascular disease. And again, with this inflammatory thing that goes on with visceral fat, you do find that again, it puts a strain on the heart, but also the inflammatory effects in the little blood vessels are a good, strong driver of calcification and hardening of the arteries and buildup of these little sticky, glommy, fatty substances, which again can lead to trouble. So again, weight is not just it's not at all about vanity. It's about health. And so I think, again, as there's more and more push on some of these GLP-1s, and again, trust me, I understand that the drug companies are doing this with the motivation of selling drug. I am not so naive to think that they're not gaining from this. But there's a benefit to patients, to appropriately selected patients from a long-term health point of view. So although there is, again, a sector and industry that is definitely financially gaining. 100% they are. We can't pretend they're not. There's definite patient benefit that comes from this. So the use of a GLP-1 as part of a comprehensive program is just a lever that sometimes can move the needle on that weight. If it was easy, everybody would have done it and we wouldn't have the obesity problem that we have. If it was simply a matter of move more and eat less, we wouldn't have the weight issue that we see out there today. There's a definite metabolic component that happens. And again, if I think about my practice population, we see a lot of women here. And because we do cosmetic procedures, we see a lot of women here who are kind of that age and stage, just like me, who are seeing changes that are happening and are trying to thwart that. But at that midlife stage, we're also seeing metabolic shift. And girlfriend, the struggle is real. So again, I cannot tell you the number of patients. It is a very high percentage of women going through perimenopause and menopause who have been active their whole life and have had very appropriate body composition their whole life so far, suddenly finding that they no longer have that and that there are issues around trying to get that midsection weight off. Sorry, there's like an emergency alert coming through as we talk about this here. It's a weight epidemic emergency, but no, it really is. So in midlife, you can do everything right. You can move more and eat less. It can still be a problem. Now, this doesn't mean we go barreling ahead with GLP-1s. There's some very important considerations here. Rightfully, people have identified, well, what about sarcopenia? What's that? That is the loss of muscle mass. And this is a known complication that can happen with the use of a GLP-1 inhibitor. Why? Well, let's put it this way. If you do not compensate for the reduction in calorie by using high quality calories, good nutritious food that is protein forward, your body will take calorie from where it can, which is again from some muscle, and you will lose muscle mass. Why have we seen that so much in so much early days? The problem is using GLP-1s not under direct supervision by a care provider and not with no counseling around the importance of diet. This is an important discussion to have because again, you can get yourself into some suboptimal conditions if you start to lose your muscle mass. That's absolutely not what we want to do for a couple of reasons. Muscle is critically important to your overall metabolic function. And loss of muscle is not ideal. We want to lose fat. Muscle strength loss, again, you become frail. So we don't want that either. But here's the deal with this. If you're looking to use a GLP-1 as a standalone type of easier solution, if you want to call it that, without a commitment to trying to eat healthier, which was, again, balanced diet, protein forward, 25 to 30 grams minimum at each meal, if you are of average size, and drinking an appropriate amount of water, you really do run the risk of having muscle loss. So again, to break it down in simplest terms, if you're someone who obtained it, for example, on an online site without supervision, without counseling, and let's just say for argument's sake, we're going to create a hypothetical vignette here. So again, this is a hypothetical vignette. This isn't a real patient that I'm thinking of in my mind. So I'm not reaching anybody's story here, but let's just think about this sort of an average person who hears about this, goes online, finds one of these online subscription services, gets it, but does not have direct counseling from a medical professional, does not get direct specific dietary advice, and doesn't have follow-up. They're going to carry on with the diet they had beforehand. So if you had a lousy, highly processed diet before starting your GLP-1 inhibitor, the GLP-1 inhibitor is likely going to reduce your appetite in most people. And then now you're just eating a crummy, highly processed diet, but a lot less of it, a lot less of it. You're now in a calorie deficit. This is the exact situation we don't want to be in. With a poor diet, not enough protein, not enough variety, fruits, vegetables, nutrients, and you're now calorie deficient, your body is going to do what it needs to do to try to protect itself, and it's going to take those calories from your muscle. And this is where the weight loss happens. That results in muscle loss. So this is a common problem when we don't deal with the other facets of it. So GLP-1 is a lever. It is part of a broader program where you need to be able to, again, have healthy, established amounts of protein, vitamins, nutrients, and water, along with trying to move more and add in a little bit of resistance training. Then from there, we can do this in the healthiest possible way. So again, there's some great options there. And if you've been afraid of it because you've been hearing so much about the muscle, I would really encourage you to have a private conversation with your own care provider about this issue of sarcopenia and what steps you can take to try to reduce that from happening to you, while again trying to make yourself healthier overall. Again, it's a revolutionary tool. It isn't for everybody, but there are some definite populations of people who really benefit. And again, it's not just about looks. Yeah, I can't lie. It feels terrific to be able to fit into those old pair of jeans again. But your health will thank you as well. But we need to take this all into consideration. Another thing we see here in our office, which is popping up more and more as these GLP-1s are coming, is we have patients who have been on them from outside providers or some of these less followed online sources, and they've had very, very rapid weight loss in a very short period of time. What happens to them is they get, this sort of typical GLP-1 face where they've lost a lot of facial volume. This is a real problem. When we lose fat on our body, we will also lose fat on our face. And even if we gain that weight back, oftentimes it doesn't always come back where it was lost. So facial fat gives the face support. It projects the skin in doing that and in filling things out. It holds the skin in place. Gravity is always pulling down. And if you lose facial volume, it's like deflating a balloon. The skin has nowhere to go but down. And so that's what we see. So in the loss of volume with the facial fat, we can find that people unfortunately have struggled with their weight for years. They finally are feeling good about their body shape, but now they really feel like they've aged a decade in a very short time frame. So you kind of traded one problem for the other. Now let me be really clear about this. The health benefits of having, again, the weight loss on your cardiovascular system, your muscles and skeleton for wear and tear, prevention of metabolic related illnesses, again, is so important. And again, is the most important thing. Yes, we can actually do some things though to try to help with the volume loss in the face. And this can be a multidisciplinary approach. And again, we have ways to look at it. So let's take a look at a couple of the options. So when we've had, and we're going to talk about the slower weight loss patient after this one, but this is the most extreme case. So this is the very rapid weight loss in a very short period of time. Again, they may have a lot of loss in the midsection of their cheeks, so they almost have lines and ridges coming down. The jawline, because they've lost the facial fat, that projects and holds things up. Again, the skin is now unsupported skin, and it sags and creates some of these jowls in the lower face. So one of the most definitive options, again, is a little bit of lower facelift or plastic surgery. There is a reason why we still have surgeons here today. And again, sometimes these are things we consider to try to get everything to align and to match. But for some people, again, after going through these journeys or other health reasons, personal beliefs, or any particular reason that is unique to them, do not feel comfortable with that layer of intervention. There are also some less invasive non-surgical things that can be done. So sometimes what we do is use a little bit of very careful filler placement, minimum. Filler is a gel that is most commonly made out of a substance called hyaluronic acid. And that gel attracts water to it, it adds volume, it used to sort of revolumize where there's true loss of facial contour. So that's one thing that can be done. In conjunction with that, sometimes folks need a little bit of tightening of that connective tissue because again, there's not all this volume here anymore. And even with filler, there's still not as much. So again, to reposition the connective tissue or to tighten it, sometimes again, surgery, facelift, where you stand in the mirror and you kind of do this, that's one option. Another option is focused ultrasound. Focused ultrasound can go through the skin. It doesn't hit the skin at all, just like when you have an ultrasound of your gallbladder or your appendix, it looks right through. But if you focus it like a magnifying glass, you can make little hot spots, and then you can actually hit the deeper connective tissue below to stimulate it like a little wound healing response so it contracts and thickens up. And that also can help to lift tissue structure. On the surface, again, the surface superficial fat can be thinned right out with the inhibitors as well. In that situation, sometimes we use something called a biostimulant. So it's a little bit different than a filler. A filler really just adds volume. A biostimulant creates a little bit of controlled inflammation in a way to try to make your body make its own natural collagen. So sometimes, again, with doing a little bit of lifting and tightening with focused ultrasound, and then going over top in some of those more lax or crepey areas with a biostimulant, you can, again, really help to give back most of the integrity of the skin that was there before. Again, to 100% reverse the loss, that is not often a realistic expectation. But again, to make a meaningful, noticeable improvement such that you kind of go in the mirror and go, okay, there I am again. That is something that can often be done. So we look at it that way. And why so many things? Why not just one or the other? Well, that has a little bit to do with anatomy. And that when you lose weight like this, it's affecting multiple layers of the face. The face is in layers. Kind of the best way to think of it is to think of it as a layer cake, So at the deepest layer of our cake, we have hard structures. So that's like the bone. Then the next layer of the layer cake is like the deep fat. Then the next is connective tissue. That's the stuff that you get pulled when you go for a facelift, or that we hit with focused ultrasound when we're trying to do a little bit of lifting without the scalpel. So that's like the third layer from bottom. Then there's a superficial layer of fat, the fourth layer, and then the top, the tippy top, that is actually the skin proper, the way you think of the skin. So when we have rapid weight loss, we see thinning in a number of those different areas. We see it in the superficial fat, that thins out. We see the loss in the deep fat, that thins out. Then we see the sagging of the connective tissue because it's no longer supported by the deeper fat below. So all of those areas need a little love sometimes afterwards to try to restore things back to where they were. Now, this is scenario one, when we have somebody who's had a lot of rapid weight loss. They're already kind of at their goal and they've done it very quickly. And again, things haven't had a chance to normalize and equilibrate. The second scenario we have is more controlled weight loss. So if we go and do this in a little more controlled fashion, it's a little slower, still with the same goal in mind, sometimes we have the opportunity to try to start the intervention process before everything gets fully sagging. So again, focused ultrasound ahead of time can be done partway through the weight loss journey, and that may help just again to give some lift and kind of hold and restore, as well as again doing some of the biostimulators on top. So just by losing weight a little more slowly, sometimes we don't see as much of that fat loss. Again, sometimes it still happens, but we can take control on the journey, on the way, to make you touch down feeling a little more restored and a little more congruent with yourself. So again, GLP-1s, they have their place in medicine and they are here to stay. There are some definite concerns. These are not things, they're not candy. They're not things just to kind of be taken without supervision, because they really do have some things that you have to be concerned about, like the sarcopenia or the loss of lean muscle mass, amongst other things. And so they're best undertaken with your own care provider. So again, these are things we like to touch on. In perimenopause and menopause, they can be a useful tool alongside traditional hormone therapy, again, because this is a common shared journey that so many women have during perimenopause and menopause. I actually spent some time just recently, I'll pop it up here. I wrote a book specifically about what happens during perimenopause and menopause. It's really more of an advocacy book on how to get the care you need, how to inform yourself about what the current literature and thoughts say in regards to hormone replacement therapy. There's been big swings of opinion over the last 2 decades. And if you have fear about hormones based on stories you heard from the early 2000s, the literature and the evidence has changed, and it's worth at least reviewing it to see if it's appropriate for you or not. So this kind of walks you through how to do a bit of that literature review. And then again, the medical profession is still trying to catch up as well. Some people are a little more comfortable with this and other people still aren't. So there's a bit of guidance there on how to go into your appointments a little more informed, feeling a bit empowered about how to ask and talk about things once you've kind of come to a position where you feel like you want to move forward. So again, it's written in regular terms. There's not a lot of medical jargon in there. We try to make it friendly. And with it also too, here, let me take this down. I also, if you scan this QR code, this is for a workbook. So whether you get the book or not, this is for everybody. There's no cost. So please, again, it's not a scam. There really isn't any charge for it. This is a workbook that has a lot of worksheets and tools and self-assessment things and preparatory things that might help you, your coworker, your sister, go into one of these medical appointments more prepared. So please feel welcome to scan the little QR code right there. And from there, you can kind of walk through some of the detailed worksheets and prepare yourself for when you go into your next doctor's appointment. So anyways, that's all we have time for today. I really want to thank everybody for being present today. If you want to learn more about any of these different things, whether it's the focused ultrasound or the fillers or the biomodulation, again, we have our little website logo down here. You can scan that. That'll take you to the website. We also have a little bit of information about GLP-1 with our hormone program, which is there for you as well too. And if you like your content here today, or if you didn't and you want to give me some suggestions of something you'd like better, please feel free. I'd love to hear from you. I really would. And please feel welcome to subscribe to the channel. We're really going to try to stay on current topics that really matter and make a difference in your life. So again, just to wrap up, please be aware again, if you're joining us partway through, that everything we talked about here today was for educational purposes. It's not specific geared to you medical advice, and anything we say here is always best applied to you under the guidance of your own care provider who knows you the best. So until I see you next time, thank you for watching, and I hope you enjoyed today's episode. Please feel free to message me if there's things you want me to talk about. I would love to involve some of your questions right here as we do our little podcast. Have a wonderful day, everyone.